For the third lab activity, we're going to learn how to perform active range of motion and passive range of motion. For the active range of motion component, patient is going to stand in front of the doctors, and the doctors, we're going to observe our patients as the patients go through each motions of the shoulder. First motion is abduction. Doctors ask your patients to go into abduction. The easiest way is for you to show your patients. As your patients go into abduction, try to see if there's any restrictions in motion or asymmetry. Normal motion is in between 160 to 180 degrees. Second motion is adduction. Doctors ask your patients to go into adduction. Easiest way for you to do it is to show them. Normal motion here is about 20 to 40 degrees. Look for any asymmetry or restrictions. Next is flexion. Ask your patients to go into flexion. Normal range of motion here is about 150 to 170 degrees. Look for any asymmetry or restriction. Next motion is extension. Normal range of motion here is about 40 degrees. To check external and internal rotation, we're going to have our patients go into abduction to about 90 degrees and elbow flexed. We're going to have our patients go into external rotation and internal rotation from this position. For passive range of motion, we're going to have our patients on their side. Let's start with extension. With the patient on his or her side, we're going to use our cephalad hand to stabilize the scapula. Your caudal hand contacts the forearm and moves the humerus into extension until the barrier is felt. The caudate hand should also have a little bit of a down force towards your patient's feet to make sure the scapula is stable. In this position, you should be able to move your patient's humerus into flexion pretty easily. Don't forget to stabilize the scapula with your cephalad hand. As you're moving your patient's humerus into flexion, look for the barrier that needs to be felt at the end of the range. To check abduction with internal rotation, let's have the patient's hand rest over your forearm and move the elbow into abduction with internal rotation until the barrier is felt. Continue to stabilize the scapula with your cephalad hand here. In this position, move easily into adduction with external rotation until the barrier is felt.